Eosinophilic GI diseases have been associated with a number of other comorbid conditions, including autoimmune diseases, connective tissue diseases, but to date have not been associated with the incidence of cancer. The only time that that may be considered as the case is in patients who have hypereosinophilic syndromes or in patients who the eosinophils are associated with inflammatory bowel diseases such as Crohn's disease or ulcerative colitis. So if a patient were to develop cancer, alternative consideration should be made for the underlying diagnosis.
The common sense would say they should, yes they should. When you have this degree of inflammation and the inflammation on biopsies in patients with EGIDs like EOE is very intense, it's very intense inflammation that you would think, oh my, why is cancer not happening? But as someone, we are discussing this recently, there have been a couple of papers that have retrospectively looked at patients who had Barrett's esophagus, which is a cancer of the esophagus, and looked at how many had EOE, and they found some correlation. But by and large, the practical discussion is that we do not believe, based on the limited data we have, that EOE results in esophageal cancer. Now, this disease has been there for about 20 years now. I'm sure if this contention was incorrect, that we would be seeing a bunch of cancer. 20 years is a long time to have inflammation and not get cancer. So I do feel that EOE doesn't, as a rule, lead to cancer. And that is further substantiated by what one of my dermatologist colleagues told me recently, like people who have eczema don't get skin cancer. And EE is also known, also called the eczema of the esophagus, because the lining of the food pipe is similar to the skin lining. So now, which is different than the lining of the stomach, small bowel, and colon, which is a columnar epithelium. And that's the second bucket of EGs that we just don't know whether. So I can say that the eosinophilic inflammation of the esophagus probably doesn't lead to cancer. Does eosinophilic inflammation beyond the esophagus lead to cancer? I don't know, based on two things. A, it's a different lining, it's a columnar epithelium, not squamous epithelium, so it may act differently. And B, we just don't have enough number of patients about those that to make a very solid statement at this point.